I'm Todd, Neale of MedPage Today. A meta-analysis of trials involving calcium supplementation for patients with or at risk for osteoporosis found about a 30% increased risk of myocardial infarction among those who received a supplement. Dr. Domenic Sica, chairman of clinical pharmacology and hypertension at Virginia Commonwealth University, who was not involved in the study, discussed the implications.
The consumer should take away from this an idea that if you're going to take it, have a benefit. Now, if you can't prove a benefit, then the risks become weightier in nature. If something had a benefit, then you weigh the risk-benefit. But there's no clear benefit from just supplemental calcium that we know of. Therefore, the risk of heart attack, as was seen in this study, which is a very small risk with lots of critiques of the study that can move forward, that becomes more prominent because you can't show the benefit of the therapy in the first place. So I think what they should take away is cautious use, if any, use of a calcium supplement if your blood calcium is low, but not use of calcium as a supplement to make your bones healthier and hardier for the long-term run. And this is primarily directed towards females, although a number of males now are having bone health issues, osteoporosis, fractures. It doesn't seem to be the domain of females only.
Sica said any risk conferred by calcium supplementation would be secondary to a range of established cardiovascular risk factors.
So I'd be telling the patient that the act of taking calcium alone may need to be reevaluated as we move forward. And in that same patient, I would tell them that the risk of taking calcium alone is very small. And I would say to them face to face, if you have diabetes, if you have hypertension, if your lipids are abnormal, and if you smoke, I'm going to deal with those issues, which are dramatic risk factors for an MI. This is a small peripheral risk factor. So if I don't get your diabetes under control, if I don't normalize your blood pressure, if I don't change your lipids, and if I don't take the cigarette out of your hand, then this is really immaterial. Those really are the big 800-pound gorillas for MI heart attack, and this is a small chimpanzee, if you would.
For MedPage Today, I'm Todd Neale.